From our state capitol newsroom tonight, there are about 836,000 Tennesseans who don't have health insurance. That's according to the Census Bureau. Governor Bill Lee is hoping a Medicaid block grant program approved under the Trump administration will stay in place and help lower that number. But Capitol Newsroom reporter Gerald Harris tells us why that plan is now facing legal questions and a new Democratic administration in Washington.
With a new administration come new rules.
So we're working hard to make sure that we can keep that block grant. We are hopeful that the Biden administration will work with us to allow us to have it.
Governor Bill Lee is hoping to receive Medicaid funding in a lump sum, something that would be a first for a state.
We just hope that the administration sees the value in this waiver that we have and the ability that we will have to serve more low-income folks in our state with greater level of access to health care and more services. We hope they see that, and we're hoping to be able to show that to them.
Lee secured the approval under former President Donald Trump's administration. However, President Joe Biden's administration will review the waiver.
This is a humanitarian issue. Shouldn't be a political issue. We're talking about people's ability to live and to have access to the care that they deserve.
Representative Antonio Parkinson, a Memphis Democrat, says the proposed block grant only applies to those currently eligible under existing rules and says more can be done to ensure working Tennesseans.
It really doesn't, help any more Tennesseans that are without insurance. Now, expansion of Medicaid will allow for the eligibility for folks that have access to Medicaid insurance and the Affordable Care Act, which will allow many, many more, almost 300,000 in some estimates, Tennesseans that are working but cannot necessarily afford insurance while they're working.
If enrollment under the waiver increases past original calculations, funding would increase.
This block grant will allow us to provide more services and potentially provide a greater number of people that have access to those services.
The block grant would also cover core medical services for the disabled and blind, children, adults, and elderly, or about 1.2 million Tennesseans. Parkinson says the best way to address health care is to make necessary investments.
We have over almost $2 billion with a B in our rainy day fund in the state of Tennessee. We could afford to expand Medicaid, which would bring additional billions of dollars into our state to help ensure those people that are struggling to have access to great health care.
In Nashville, Gerald Harris, News 2.
Now, lawmakers will have to vote on and approve any changes to the state's Medicaid program. The cost of the initial block grant proposal was $7.9 billion. Now, we reached out to the U.S. Department of Health and Human Services to find out if the Biden administration plans to keep the waiver in place. We have not yet heard back.